This video will describe the Chrome records needed for a double edentulous patient. As with all of our records, you can visit our website and under Chrome GS and then Patient Records. And then once you're on the page, you can scroll through the page. You can see here's an area for single arch, here's an area for double arch, and then right below that is Patient Record Checklist. You can print these off and you can use them as you're collecting records, but right before submitting a case. Let's go through the Chrome records for this double edentulous, which is a very straightforward process of collecting records. You'll need photographs and you'll need dual scans. The photographs are very simple. Full face, full smile, and then retracted center, left, and right with the patient in occlusion. We need no other photographs. If you want to send a profile photograph because we're dealing with lip support and we're dealing with maybe class 1, class 2, please send those along too. But we do not need any other photographs. As with all edentulous cases, we will need dual scan. And dual scan means you scan the appliance once in the mouth and then once by itself. To fabricate or to convert a prosthetic to a scan, to a dual scan prosthetic is very simple. We need a denture that fits very well, no movement. If there is any movement at all, you can do a hard reline. Do not do a soft reline. It will not show up in the CT and it'll look like voids. If you do need to do some type of reline and you want it to just be very temporary, use blue or green mousse. They're radio opaque and they show up in the CT. The tooth position really should be ideal, but it does not have to be perfect. We can do a lot of things digitally here to make more ideal setups. Then again, green or blue mousse. And then it must be a dual scan in occlusion. We'll go through that in just a minute. We do not need impressions. We do not need, I'll have a slide on that in a second. So this is a denture that the patient already has, and the doctor just simply put 6 stickers on the prosthetic. I think there might be one on the facial too for 6 because this is 5. But the rule is 6 stickers randomly placed around either the palate or on the buccals of the teeth, never on the intaglio and never on the occlusal surfaces because we need the patient to occlude. This image here has some gutta-perca markers. So in case you don't have stickers, you can just use a number 8 round burr and fill the holes with gutta-perca and just smooth it off so the patient is not irritated if you're doing it in a denture. This happens to be a scan appliance, which is a duplicate of the denture. If you do not have a denture or if the denture is just unacceptable, then follow normal denture fabrication procedures. You can do a dual scan when the teeth are in wax or take it all the way to finish and then you have a backup denture for the day of surgery. If there's any questions about denture appliance fabrication, please call us. It's critical that that part is completed correctly. We do not need any other impressions. No study models, no impressions of the tissue, no impressions of the denture. We just can't do anything with these. We actually take the dentures and we turn them into STL files. We print them, we articulate them. We can do everything with the scan that the patient is wearing the dentures with. Dual scan. When you complete a dual scan with a double edentulous, there are 3 CT scans, and I'll explain that in the next slide. But the patient should be wearing either the scan appliance or the dentures during one of the scans in occlusion, with the chin on the chin rest. This will explain the dual scan process, this slide. So there will be 3 scans. 1, the patient wearing both dentures with markers. When you do a preview or a review on your CT, you won't see the dentures. They're radiolucent, they won't show up, but you will see the markers, so you'll know you've captured the scan correctly. That's 1 scan. The next scan is of the appliances by themselves with the markers still on them. So you see 3 here, but there's actually 6 on each of these. Doctor just put 3 on the buccal, 3 on the palatal, and same thing here. This scan is important. You'll take the appliance, you'll put it on a piece of foam or something like foam and place it on the scan table. Most scanners have a scan table. So scan it alone and then do the same thing for the opposing arch. So these are not scanned together. So you have 1, 2, 3, 3 separate scans. And we want this not sitting on hard plastic. If it's sitting on hard plastic, it marries itself to the hard plastic and we can't separate it. So the scans here are very, very simple and straightforward. There's just some rules. And if you have any questions on that as well, please give us a call. And the next thing to do will be to export all 3 of these scans so that you can upload them. So just for demonstration purposes, let's say you've taken all 3 CTs, you've exported them to a folder on your desktop. Whenever we help with this, we always make a folder called Row CBCT Scans. And in here, there will be 3 for patient Duffy in this example. And what you'll do is, the best thing to do is to change the names of these to, let's just say this is Mandible Appliance. Let's say this one is Max Appliance. And we'll call this one the patient. Now we know that we've captured all 3 scans properly. Then you could make a new folder and you could call it CBCT scans, and then put these folders in it. 1, 2, 3, and we're just going to have a look at this one real quick. So this one has all of the scans 0 through 210. So now we know it's in a multi-file format. If this just has one file, then you've exported in a single file format. You want to have multi-file. Very important. All scanners can do it. Just have to find the right buttons to push. So I went back, and here we are with the patient scan, and inside here are the 2 appliance scans. I'm going to drag it in here. Inside of here we have all 3 scans. And I'm going to go back. This is the main scan we made for Duffy. I'll even call it Duffy. And now you've organized your CT scans, and now you'll zip them into one zipped folder, which is right-click, scroll down, send to, compressed zipped folder. It's the same on every PC computer. So now we're zipping them into one master folder. And then you'll take this folder with the little zipper on it, and you'll drag and drop that into our portal, and that's how you upload your CT scans along with your photographs. And if you've scanned with a digital impression, then you've also included your STL files. Those are the records for a double edentulous case.